Good morning, everyone. Thank you so much for joining us for a very exciting product rollout here with Senior Marketing Specialist and Mutual of Omaha. We're thrilled to, and by we, I mean our good friend Christy Myers over at Mutual of Omaha is thrilled to present the Hospital Protection Plan by Mutual of Omaha. I know that internally at Senior Marketing Specialist, we are all thrilled to hear about this new product. I know there's lots of us internally that are on the webinar right now, as well as all of you agents. So we're hope that you're excited about this too. But before we get started, just want to let you know that we do have a chat box. So please feel free to ask questions throughout the webinar. Makes our job a lot more fun and makes it a lot more productive for you. So throw those questions in there. Only I can see them. So lots of privacy and stuff like that there. Throw those questions in. We will have a Q&A portion at the very end. So if you want to save your questions for then, that's totally fine. Otherwise, I will try to politely interrupt our friend Christy throughout it to make sure that we get those questions answered. And today will be recorded. So if you have to jump off, that's totally fine. We'll have this uploaded on our YouTube page later today. And then you might receive a follow-up call from our team. Oh, I think there's an echo, so let me turn this down a little bit. We do have a team that will be giving you guys follow-up calls, not to do anything other than just check in and make sure that you guys have all your questions answered and everything like that. So without further ado, I will quit yapping, and Christy, I'll hand it over to you.
All right, sounds good, Sadie. Thank you so much for having me on today. I too am very excited to share the details of Mutual of Omaha's brand new hospital protection plan. And before questions start going into the chat, I will tell you the states in which we have approval in and our official launch date at the end. So that way I know you'll stick around. So with that, let's dive into the details that I am so happy to share here with y'all today. So before we do start, there's a few keywords I want to make sure everyone's on the same page with. And really, we all know what calendar year is, but I want to point out Observations Day because that one is sometimes a question. So for us, Observations Day is going to mean it starts at 6 hours of observation, and then after 24 hours, it's going to be considered hospital confinement. So just a few keywords there to get us started here today. And then here's the basics of what our hospital protection plan will look like. Issue ages are 18 to 85. The guaranteed issue ages 64 to 74. So great opportunity there with that broad GI range. Automated underwriting, so meaning it's either going to be issued or declined. We do have a household discount, and I'll talk about that here in a little bit. The product is going to be guaranteed renewable. So as long as your client pays their premiums on time, they can have this coverage as long as they would like. There is not going to be a client ID card. There's no policy fee or application fee. There's no waiting period for coverage to start. And then there is a 6-month look-back period for pre-existing conditions. Now, the base benefit options, when you are assisting clients with this product, they're going to first have to choose, do they want to go with a daily benefit amount for a certain number of days, or do they want a lump sum benefit amount? So the daily benefit amount is anywhere from $1,000 to $1,000, and then they pick their day options. So 3 through 4, 5, 6, 7, 8, 9, or 10 days, 15 days, 20 days, or 31 days. If they go with the lump sum benefit amount, they just go ahead and choose from an amount of $100 to $3,000. Also built into the base benefit amount is Observations Day, which means we're going to pay 100% of the daily benefit amount selected for the lesser of 5 days or the base hospital option selected. We also have a built-in inpatient or mental nervous disorder benefit, which is going to pay $175 a day, up to 7 days per calendar year. And then my favorite feature is going to be the fact that we have built-in pet boarding, and that is going to pay $75 a day for up to 14 days per calendar year when your client is hospital or skilled nursing confined. Now, when your client purchases this hospital indemnity plan with Mutual of Omaha, they do get a few value adds at no additional cost to them. And those are going to include our iMed Vision discount program, So that will give them a discount on eye exams and eyeglasses. We also add on the Amplifon discount, which is discounts for hearing tests and other valuable services. They also receive a discount on Garmin smartwatches and fitness trackers. And they also have access to discounts on advanced voice activated in-home medical alert and communication systems from AlloCare. And they also can save money on prescription drugs by using the ScriptSave RX value add. And this brand new product is going to come with 9 optional riders. And we will go through what each one of those looks like here. So the first one is the guaranteed purchase option rider. And I've been hearing a lot of good things about this one. This one is going to allow for your client to increase their daily benefit amount by 15% after their first policy anniversary. They may elect to increase that benefit up to 5 separate times over the life of the policy or to age 85, whichever comes first. The additional base benefit premium is based on the original issue age of the policy, and no additional underwriting is required. If the rider is canceled, the daily benefit amount would revert back to the original amount, and the premium would be reduced to that original benefit amount. So let's take a look at how that one's going to work. Let's say, for example, you have a client that you write this hospital indemnity product on, and they have a September 1st effective date of this year. Excuse me. In August of next year, they decide to notify Mutual of Omaha because they want to exercise that guaranteed purchase option right. In September of next year, they will then have a new daily benefit amount of $575. So that's assuming the original daily benefit was $500. You can see over time, without the guaranteed purchase option rider, the daily benefit amount would just be that $500. That's the dark blue line here. But by exercising that GPO right each year in this example, you can see by the time 2030 comes around, their daily benefit amount is almost up to now $1,000. I think this is just a great rider. We all know costs continue to increase, they don't decrease. So definitely take a look at this one. I think you'll see great value in it. The next one is going to be the lump sum cancer rider. In this case, the client will select a lump sum benefit amount of $2,500, $5,000, $10,000, $15,000, $20,000, or $25,000. It does also have a second lump sum benefit amount of $600 for skin cancer, regardless of the benefit amount that was selected. This rider is going to be underwritten, and I'll talk about what those questions are here in a little bit. This coverage is only for a first ever cancer diagnosis. There's a 30-day waiting period, and then this rider would end once the lump sum benefit and the amount for the cancer or skin cancer pays out. Next up is our prescription drug rider. I'm also hearing unique things about this one too. I don't think it's a common rider with a hospital indemnity plan, which is making this one stand out. So for this one, the client selects a calendar year max benefit amount of $250 or $500. Then the rider is going to reimburse either $15 for generic prescriptions or $30 for brand name. And this one, super easy to get reimbursed. We either just need pharmacy receipts or explanation of benefit statements from their Medicare Part D plan. But I do also need to note that while this rider can help to standalone Medicare Part D prescription drug plans, the rider is not connected to PDP, and nor should it be marketed as a PDP replacement. Next up is the skilled nursing facility rider. This one does require a hospital stay of at least 2 days. Care in a skilled nursing facility must begin within 30 days of that hospital discharge. And then the benefit period will end with 60 consecutive days of not being confined in a hospital or skilled nursing facility. For this one, your client's going to go ahead and choose a daily benefit amount from $100 to $500. And then they need to pick how many days do they want to have covered per confinement. They can either choose days 1 to 20, 21 to 100, or days 1 to 100. Next up is the home health care rider, and this definitely means home health care received in your home and provided by a home care agency. To receive benefits, it does require 2 days of a covered hospital stay or skilled nursing facility confinement, and the insured must have a cognitive impairment or the inability to perform 2 of 6 ADLs. And then the home health care must begin within 30 days of hospital or skilled nursing facility discharge. And for this one, the rider, the client needs to select an amount from $50 to $250, and then they are able to collect benefits for up to 30 home health care visits per calendar year. Next up is the ambulance, emergency, or urgent care rider. For this one, the client picks an amount from $100 to $500, and then each benefit, so ambulance, emergency room, and urgent care, is payable up to 4 times per calendar year. Do note that ambulance is ground, which may include water ambulance plus air ambulance total. It's not going to be 4 ground plus 4 air. Urgent care is going to be paid out at 50% of the chosen benefit amount. Air ambulance is paid out 10 times the chosen benefit amount. And then ambulance and ER benefit can be paid on the same day. Next up is the outpatient surgery rider. In this case, the client will pick a benefit amount of $250, $500, $750, or $1,000. No waiting period for coverage to start. Benefits are paid for a maximum of 2 outpatient surgeries per calendar year, and there's no benefit reset period. Only 1 payment can be made per day, even if there is more than 1 surgery per day. And then outpatient therapy rider. For this one, the client picks a daily benefit amount from $50 to $250, and then they pick a coverage amount from either 15 days or 30 days per calendar year. We do have a built-in chiropractic benefit on this rider of 5 days per calendar year, and then the benefit is paid once per day, even if multiple therapy sessions do occur. And this benefit is only paid for therapy sessions in an outpatient setting, not a home setting. And then the last rider is the major diagnostic testing rider. For this one, clients choose from a range of benefit amounts of $100 to $500, no waiting period. Benefits are paid for a maximum of 2 diagnostic tests per calendar year, and there's no benefit reset period. They can receive both tests on the same day, and we just need documentation from the hospital or medical provider for that benefit to pay. So here's the tests that are going to be covered. I'll let you read through those real quick. All right, end of riders. Let's talk application and underwriting processing. So with this product, as I mentioned earlier, the guaranteed issue age for this product is 64 to 74. People who are outside of that GI range will need to answer 2 health questions on the application. So those are going to be, number 1, within the past 5 years, have you been advised by a medical professional to have any medical test, treatment, therapy, or surgery that has not yet been performed? This does include appointments that have been scheduled. And then question number 2, do you have any pending test results? This includes test results from routine procedures such as mammograms, pap tests, colonoscopies, or PSA tests. So those are the only 2 questions outside of guaranteed issue. In addition, I mentioned the cancer rider does have some additional questions that will need to be asked. I'm going to pause here for a second for you to read through those. All right, next up is the household discount that I mentioned. So we do have a 7% household discount available on this product. In order to qualify, a household member either has to have an existing hospital indemnity policy with or is applying for coverage with Mutual of Omaha. So a household member is going to be someone that you have continuously resided with for the last 12 months, or it is someone that you are either married to or in a civil union partnership with. And then with regards to the premium structure, so the rates are unisex and they are issue age rated. Rates do not vary by tobacco usage. They do vary by state. We mentioned that 7% household discount available for qualified individuals. There is no policy fee or application fee. And then at time of application, you will need to collect the initial premium payment amount, which you can do by either automatic bank withdrawal or credit card. And then you also need to note on the application the ongoing renewal premiums, which can be done via automatic bank withdrawal or direct payment via check which can be either quarterly, semi-annual, or annually. And then quoting, I want to mention I've had a lot of questions on where do I get the rate sheets. So we do not have rate sheets, and we do not have a paper app with this product. The only way that you will be able to enroll someone for this product is by using our e-app storefront. And that is where I'm going to also recommend that you do your quotes from. So quoting you can either do from the e-app storefront, which is exactly on our agent portal sales professional access, right on the home page on the left-hand side, and I'll show you a picture in a second. Just pick electronic applications, and that's where you'll go. The other way that you can quote for this product, as well as all of our other products, is by using our mobile quote app. And to get that, all you need to do is go to your respective app store and then go ahead and search for quotes for sales professionals. Once you do that, you'll download that mobile quote app, and then you can quote our med sub product, our dental product, as well as our hospital indemnity product. And here on screen, you are seeing an example of what that quote would look like. So you will dial in the daily benefit amount in this example and the number of days, and then all the optional riders are there for you to pick from as well. And I'm sure you're curious about rates. Now I'm hearing really good things about these rates. They are looking very, very competitive. I'm showing you here either issue age 65 or issue age 75. And then I'm also showing you what the rates would look like with the household discount and without. And then that is for the daily benefit amount of $350. And then you can see the number of days elected here. And then you can also see the pricing in this example for the 9 optional riders that we have available. So I'm hearing this is very competitive out in the market. So look forward to this one going live. And then I mentioned the application electronic only, so no paper apps. And this is the homepage to Sales Professional Access. And you can see right from the homepage, you click electronic apps. The next screen is going to be the very first link on the top of the page that you will pick to do the electronic app for HIP. And then how do you submit claims? How do you help your clients with that? So once there are claims to be submitted, they can do so by one of 4 ways. They can call in a claim, they can email claims, they can mail it in, or if they have access to a fax machine and know how to use that, they can actually fax in a claim as well. So many easy and consumer-friendly options to submit claims. And then sales and marketing, just to give you an idea of some ideas as to how to sell this product. I know filling in those gaps with the Medicare Advantage completely makes sense. I would definitely recommend that you dial in the daily benefit amount and the number of days to kind of mirror up to what their Medicare Advantage plan summary of benefits is going to be for the plan that they're electing. In this example, the person has a $325 copayment for days 1 through 6 for inpatient. So the agent recommended $350 a day for 7 days. And the cost for that with our household discount for a 65-year-old was just under $30. And in this example, they also wanted to add on that ambulance rider for $3.86 per month. So for less than $34, you're covering their biggest worry with respect to covered inpatient hospital stays and giving them that peace of mind that they're looking for. I think the other way that you could be selling this, just as an example, would be maybe you're going to add on HIP policies to high deductible Medicare supplement plan G plans. Now we know their medical needs are going to be covered with that high deductible med sub plan, but there's always additional cost when you are going to the hospital. Maybe you need to bring loved ones in closer to you, or maybe because you had a med sub, you actually traveled for care and you have hotel room stays that for loved ones that came with you. In this example, add on that $3,000 lump sum benefit amount. This person also wanted to add on the lump sum cancer rider. And just for added peace of mind, they added on the prescription drug rider. But you can see how you can really round out any of these products, including even ACA plans, because the issue ages are 18 to 85. And then additional product training is available on Sales Professional Access, including just a really nice plan overview sheet that is just a 1-pager definitely go out to a spa to look for that one. And then we do have rider sheets for all of the 9 riders that we talked about here today. And it gives a little example on each of them as to how those all work. And then we also have consumer materials available. If you are interested in this product and you meet with clients maybe face to face, the consumer brochure is very well done. I would recommend calling into sales support and getting an order of those sent to you. It makes a great leave behind piece. And then we also have a pre-approved social media post that you can grab on our social media hub. These are super easy for you to use. All you need to do, go to the social media hub, you copy the text, copy the image, and post. It's done. They've all been approved by the state insurance departments. You don't need to worry about compliance, but it's a great way for you to connect with your clients and potential new clients. And then because of all your hard work, Mutual of Omaha is definitely known for our agent incentive trips. And I am happy to say that this new hospital indemnity product is included in the qualification for you to join us in Rome in the spring of 2026. So in order to qualify, you need 250,000 total production credits. And you can credit or earn credits now by either selling MedSup, dental, and our hospital indemnity. Now, if you're selling all 3 of these to one person, that's definitely going to help you even get closer to that qualification requirement. So I hope to see many of you there. These trips really are just outstanding and a great way for you to connect not only with home office leadership, but other agents like yourself. So hope to see you there. Next up is going to be agent and entity contracting. So the good news is, if you currently have an active MedSup appointment with Mutual of Omaha or any of our affiliates, you will be automatically set up with our hospital indemnity product. Your MedSup commission level will be the same as your HIP commission level. And the good thing with HIP, there is no additional training or certification needed. So if the product is approved in your state, you are going to be good to go. Now, if you have questions regarding your MedSup or HIP commission level, in this case, I'm going to recommend that you reach out to the McNerney team, and they will definitely help you understand what is that level and how do you, if you're new to HIP with Mutual of Omaha, they can also help get you a contract as well. So let's just wrap up a few things that we covered here today to round this out. So just a reminder on the plan overview, issue ages are 18 to 85. Guaranteed issue is 64 to 74. That's huge. Automated underwriting means it's either going to be issued or declined. We do have that 7% household discount available, and then there is no policy fee or application fee. And then at Mutual of Omaha, we definitely have that name in the broker community as having the best broker experience, and this product will be no different. The fact that there is no additional product training, we have that simplified underwriting process. We have easy quoting, and our e-app is super, super easy. Many of you are familiar with that. This product does have very competitive compensation, and you also have that opportunity to join us in London through our mutual sales leadership. And then for your customers, you know, we are that brand name that they know and trust. We have been helping with their MedSup needs now for almost 60 years. We have that flexible product design with the daily benefit options and the 9 optional riders. I think you saw the premiums are really affordable. We do have that customer service team is located in the US, and we have that quick claims handling, and they can view stuff online as well via our customer access website. So with that, I know if you have additional questions, we're going to put those in the chat here today and we'll cover those. But after the fact, if you need help, please reach out to our amazing sales support team. They truly are the heart of our exceptional broker experience, and you can reach them either by email or by phone. And then I said I'd wait until the end. So here is the sales effective date. It will go live, this product, next Friday morning, August 15th. So by Friday morning, I mean literally at 12:01 a.m. on Friday, it will be available to you to sell. These are the initial states in which we are launching at. There are 17 of them available to you. I'm going to imagine we have a lot of people from Missouri on the line. Missouri is one of the states that will be going live next Friday morning, and you can see the rest of those there. Now, I want to share the map. So the dark blue states are the ones going live next Friday. The states in light blue, we have filed with those state insurance departments. We just don't have a product approval yet. We are actively working to get those approved. And after the initial launch date of August 15th, additional states will then soon follow suit, and we will continue to roll out additional states as they become approved. At this point in time, the only states in which we will not have product in are going to be New Mexico, Minnesota, and Massachusetts. So with that, I want to thank all of you. And Sadie, I'll turn it back over to you.
Awesome. Perfect. Thank you so much. I know that you have been very busy just because it's this time of year. So you're already traveling, but I know that you have rolled out this product to a lot of people. So I want to thank you for your time here today. We were all really excited for this product. And from my standpoint, it looks like it really has achieved kind of what we wanted it to from a hit plan and everything. So it's very exciting to see lots of those benefits on there. You mentioned Garmin. I'm a Garmin girly. I know lots of people are Apple Watch people, but I'm Garmin through and through. So little stuff like that makes me excited. But of course, like riders can make or break a hospital indemnity plan, and seeing these are so exciting. We're really passionate about cancer insurance here, so seeing that
Yeah.
cancer rider on there is exciting. The PDP rider on there, lots of really exciting stuff there. Guys, we have just a few more minutes left here, so go ahead and throw your questions in there. We do have one question about the claims. Is there a claim form? And if so, where can they access that?
So we do have a claim form, and that claim form actually is an agent. You are able to find that claim form on our forms and materials, which is on Sales Professional Access. So once you're logged on to SPA, go to forms and materials, select HIP as your product, and then it will be right there, that claim form.
Perfect. Guys, we'll give you just one more minute or so to get your questions in here. But before we let everyone go and we wait for more questions, Christy, you have done this a bunch. You know this product through and through at this point. I'm curious to know what you think is one of the most, for you personally, what's one of the most standout or exciting features or competitive features for this hospital indemnity plan?
I think two things. One is the fact that pet boarding is built in. I think with a lot of competitors, pet boarding is an optional rider. So with us, it's built in. Reminder, it's going to pay $75 per day when your client is hospital confined, and it pays up to 14 days per calendar year. So having a pet myself, I know that is huge. Pet boarding can get really expensive, and the fact that it reimburses $75 is great. And then I think the other one is going to be that guaranteed purchase option rider. Like we all know, we live in a world where costs continue to increase, especially with respect to healthcare. I think having that ability to increase your daily benefit amount by 15% up to 5 times, I think that is huge. And that rider, when we looked at the sample pricing, it is not that expensive. So I think you should definitely take a look at that one because it will provide great value, I think, for the future.
Awesome. I love it. Yes, I'm also a big pet lover too. I know a lot of
Yeah.
people are, and I love how they prioritize that because whenever someone gets home from the hospital and they're recovering, that mental health aspect of it makes such a big difference in recovery, and having your animals there and being able to know that they were safe and in good care the whole time only helps with that.
Yes.
So yeah, I absolutely love that. We do have one more question and then we will get everyone out of here. Let's
Okay.
see. Will we be able to see our clients and see their plan info?
Yes. So the hospital indemnity plan will be part of the policy management pages within Sales Professional Access, and it will be included in the agent's book of business that they can download.
Awesome. Love that. We're in the age of just wanting everything convenient because we're so used to it. So it's
Yep.
nice to have that to be accommodated for.
Yeah, and we
But
made a lot of enhancements to those pages, so it should be definitely everything that they're looking for from an agent perspective.
awesome. Love to hear it. Alrighty, well that's all. Oh, nope, just kidding. We have one more question here. Are the flyers post in SPA now or not until 8:15?
The product information flyers for HIP are out on SPA right now. So if you log on to SPA and pick the products tab, hospital indemnity is now a product selection, and everything is already out there with respect to the product flyer, and then the additional details on the riders you can find as well.
Awesome. Love it. Alrighty, I think that's all the questions we have now. Throw in your very last second questions if you have them. If not, please feel free to contact our office afterwards. If we can't answer a question, we will get our questions over to Christy and make sure that we get those answered for you. But like I said, this recording will be on our YouTube page. So if you're watching it in the future, hello. But if not, you can go ahead and access that there. But Christy, I want to thank you so much for joining us here today and presenting this product. I got some good stuff, and I know everybody else is going to take away some good stuff. So yeah, excited to see this product roll out here in the next week. And thank you so much for joining us.
Thanks, everybody.
Awesome. Thanks, guys. Have a good one.